Dr. Patel.
Hello.
Hello, good afternoon. How are you doing?
Oh my gosh.
So I came home late last night, and then when I woke up, I saw your post. It's like,
You're
wait,
like,
what day
what
is it today?
are you
Did I skip?
talking about? It's,
Did I skip a day?
you know what? I am just a mess right now
No,
because
it's okay. I saw that you blow dried your hair already, so I was like,
you
we
know
have
what?
to do it.
Our
I was like, we'll do
hair
it
looks
today.
beautiful too. So,
Yeah.
I mean, we're ready.
I know. We are ready. We are ready today. Anyways, Dr. Patel, if you could please introduce yourself to everybody. And thank you so much again for agreeing to do this.
Well, thank you for having me. I think it's so amazing that you're doing this. And, I'm honored to be with such a huge
Oh,
star like
no, 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 not huge at all.
So I'm Anita Patel. I am double board certified pediatrician and pediatric critical care doctor. I work at Children's National, which is one of the top 5 children's hospitals in the country, and it's an enormous pediatric ICU, which is great. I'm also an assistant professor and an NIH funded researcher. So I do a lot of research too.
That's
So
amazing.
have my hands in lots of different things. I'm on Instagram.
Yeah, I know. That's amazing. And that's why I'm so grateful that you said yes to our live today. So I started this live stream, I think back in February in response to like so much misinformation going on around, right? So, we worked through the whole pandemic last year when the spike happened here in New York City for COVID-19. And I think the thought started when after such a rough shift, and I believe that we had like 7 patients die that night.
Oh,
And when I left the hospital, outside the hospital, there was a protest saying
oh
that,
my
oh,
God.
COVID is all a hoax. I was like, this is not right. And even when the vaccines were rolled out, right? So much misinformation all throughout social media, especially. So I was like, why don't we bring in the actual experts to talk about these topics, the ones who are actually educated and trained in these topics? And that's how I got to meet physicians like yourself. And so thank you so much. And one of the questions they always ask my guests here,
Yeah.
what led you into medicine? Was it like a family member, a friend, a personal experience?
It was oddly personal experience. So prior to me being a doctor, there were no doctors in my immediate family. My dad
Mhm,
did have a PhD, but
mhm,
is not a medical doctor.
mhm,
I have a lot of cousins in India, actually, and I have
mhm,
one other cousin who ended up becoming a doctor as well. But we have lots of PhDs in our family, but me and my cousin are the first MDs.
mhm,
To be honest with you, I'm one of those weirdos that truly, I've wanted to be a doctor since before I can even remember. I will say I've always loved science and math. Like that's
mhm,
always been sort of
mhm.
my strength. And I think it's natural to like what you're sort of
Yeah,
naturally good at, I guess.
yeah.
I just loved my pediatrician so much. Like I used to put on my fake pearls and when I was
Uh,
a tiny little girl and I'd like dress up and I'd go and I mean I hated shots back then, but I just loved my pediatrician. I loved
yeah,
how good he was with
mhm,
kids. And I just thought it was so cool that he could like learn about my
mhm.
body without being inside my body.
Yeah,
Like
yeah,
little kid brain. I was like,
yeah,
you doing this?
yeah.
And so I was just very laser focused on being
Mhm,
a doctor from a super young age to the point
mhm.
where even my Indian parents, and you'd appreciate this because you
Yeah,
have parents, even they
yeah,
were like, you can be whatever you want.
yeah,
You don't
yeah,
have to, which is
yeah,
crazy coming from Indian parents, and I'm an only child too. But
yeah.
they just were like, we want you to be happy. So I actually I didn't take any science classes my first semester of college. I went to UPenn and I took several
Mhm,
Wharton classes. My dad was like, why don't you take some Wharton classes? See how it is. And I didn't take any science classes and I was absolutely miserable. I had the worst GPA,
mhm,
like something
mhm.
crazy, just not
Yeah,
something. And
yeah.
I mean, to the point where I'll never forget this when I showed my parents my first report card. They weren't even mad. They were just like, "Are you okay? Like, what's going on?" And then
Amazing.
I like added my science classes back, and I
Uh-huh.
pulled it up, and it was fine.
Wow, amazing.
But that's my path, and I'm like, as you'll probably tell from our talk, I'm a
Mhm.
talkative person. I like being around
Yeah,
people.
yeah,
So it just melded all my passions together. And, I want to
yeah,
help people. Like I needed a
yeah,
job where I
yeah.
wanted to go to work every day
Mm,
and I was making a difference in some
yeah.
way. So
Yeah. There's really people who are really inclined into the science, right, and the maths. But still, the whole journey getting to where you are now, or even to medical school and or even internship is such a rough road, right? You spend all this time studying, applying, even for residency, and then also all the stress and the money involved as well. What I love asking my physician guests are, at the end of it all, given all of the time and the stress involved, there were a lot of sacrifices for sure, right? Especially in medical school, always studying, can't go to certain family events or whatnot. Do you have any regrets at the end of the road?
The only regret I have, and it's not even, no, I don't have regret. I do wish I had taken care of myself better. And that's not something I did, honestly, until my second year of fellowship,
Mm.
when I really hit a super low point. I did my fellowship at Columbia, and it was, I mean, wonderful training, but super, 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 super intense. You know, we were on call every fourth night, our first year, basically all year, except for a vacation month. So it was really tough. Honestly, I got so low that year that I was like, I'm not totally sure. And it was the first time in my entire career, even undergrad, med school, that I was like, I don't know if I can keep doing this and maintain my sanity. And I was really lucky at the time. I happened to be dating someone that was really into yoga, and he's long gone, but the yoga stayed.
Yeah, I know.
And I truly, like, after a couple years, and I was always like a runner, and I liked to kickback, like really physical stuff.
Yeah,
But yoga was like not,
yeah.
whatever. But I had my first yoga class, and it was a Bikram class actually. And I was like, wow, this is a real workout. And I also just felt my stress melt away. And like I couldn't even touch my knees. I was so inflexible. But I like literally, I 3 or 4 classes in, signed up for yoga teacher training in the middle of my PICU fellowship.
That's amazing.
And I mean, the rest is history. It changed my life. It, for the first time, I had something outside of medicine that I loved just as much. And I think it goes back to what I told you. Like, I have been so laser focused to be a doctor my entire life. Like, I loved med school. Like, I know that sounds weird, but I truly felt like I had arrived, and I knew I
Yeah,
was place. I was like, this is everything I ever wanted. And even if I was studying until 4 a.m. every night, I was like, I just love it. And
yeah,
same for residency. I mean, my co residents used to joke, like, after every rotation, I'd be like, I'm going to be this,
yeah,
I'm going to be
yeah,
that. They're
yeah,
like, all right. But that's just how I always loved it so much that being my only focus was
yeah,
fine for me. But as I
yeah,
got older, it wasn't, and
yeah,
I mean, and I say it like, I don't like to say regrets, because I
yeah.
think things come to you when you need them. And yoga came to me when I needed it, and it changed the course of my life. And, I'm still an avid yogi, and
Yeah. I
I'm
know. See,
good at my
yeah,
job, and
yeah.
I have a more rounded life now.
Yeah. Yeah. It's very interesting because this is my 20th episode, and every doctor that I've asked that question, they all have the same answer. Is that
I'm
there's no regret. There
Yeah.
is no regret, which is very hopeful for people like us, right, who are either in the pre-health or already medical students or those in residency. I had the residents come on and I say, you're in the middle of that 100-hour work week. Do you feel like giving up right now? And I think it's always that laser focus that they talk about, and I feel like something that they look forward to in the end. So what would be your number one advice for a student who wants to go down this road of medicine?
My biggest piece of advice, honestly, is to make sure that you want to be a doctor,
Mm,
and make sure that you love it. And I say that because I did have friends in med school through the first year or two were like, don't really like this, and they made it work for them. They
mm,
finished med school, they got other degrees like
mhm.
MBAs, and they
Yeah,
ended up doing mostly they're doing
yeah,
non
yeah,
work. But I do think it's a shame to, like, as you said, it's so expensive,
yeah,
and not expensive. It takes, you have
yeah,
be okay. As you said,
Mhm.
I missed almost like, except for in my first year of med school, a bunch of people got married, and after that, like,
Mhm.
I didn't make any weddings. Like,
Yeah.
I feel like for those years, and you just had to be okay with that. And
Yeah.
if you love it, and it's like like you have to, and it sounds so hokey, but like you
Mhm.
have to feel it. And then I guess the second piece of advice I would give to people is, don't go into medicine if you want to make money. Like,
Yeah.
other ways to make a lot of money.
Yeah.
And not just,
Instantly as well, right?
yeah,
Because it's a long time.
so I'm not saying you
Yeah.
don't make money at the end, and it's a very stable job,
Yeah.
obviously, like you
Yeah.
have good job
Yeah.
security,
Yeah.
but it's not like I could make way more money if I
Yeah.
was a business person.
Yeah.
Like, I decided not to go into private practice. I decided to
Mhm.
stay in academics. So
Mhm.
I have a pay cut there too. So,
Yeah.
you just have to make sure you really
Mhm.
love it, because if you're doing it for prestige and or money, you'll
Mhm.
be really disappointed.
Yeah, I know, for sure, for sure. I always tell this to other students as well. It's like, it's not just the debt that you take out, that debt accrues interest over time. And it's not even just about the money as well. It's literally the time involved, right? It's an emotionally and physically tolling road, even pre-med itself, and I can imagine medical school itself as well, and the residency for sure. I have friends who are residents, and each time I see them in progressive weeks, I feel like their soul is being sucked out of them progressively
Yeah,
as I see them.
it's tough. I mean, it's,
Yeah,
and because I was so laser focused on my
yeah,
career, I definitely dated people for sure. But,
yeah.
you know, I didn't get married until a couple years after becoming an attending. Obviously, I had
Mhm.
a daughter,
Mhm.
so I did really, I ended up doing everything later in life.
Yeah.
Got married at 36, and
Mhm.
I had my daughter at 38,
Mhm.
so the thing is, though, I'm 100% happy with sort of the timing of everything
Yeah,
now. But I
yeah,
tell you, when I was in the middle of fellowship, I was like, oh my gosh, like I almost felt like in one aspect of my life,
yeah,
like so set, like my
yeah,
career. But my personal life, I honestly, were moments where I was like, I just might not get married and have a
yeah,
family like I wanted.
yeah,
And I had to like start to work through that and be okay with it. Obviously, everything worked out. Is it
yeah,
good? But yeah, I mean, that sort of goes back to better make sure you're okay. Like, and
yeah,
I'm okay that I made those sacrifices
yeah,
because I love my job and I love
yeah,
my career. And but
mhm,
if I didn't, I'd be miserable.
yeah,
Like,
yeah,
screw this job. It like
yeah.
what?
And work business.
Yeah.
It's amazing.
Uh,
Thank you, Doc. I wanted to delve into pediatrics.
yeah.
Was it your experience with your pediatrician as a child that stuck with you the whole time, or was it like during rotations and clerkship?
It was definitely during rotations. So
Mm,
I have like a kind of funny story about how I ended up in pediatrics. So I will say this: I knew I wanted to be a pediatric surgeon. Like, that's what I thought I was.
mm,
I didn't know, but I thought I've always worked at summer camps, babysat.
mhm,
I've always just been around kids. So it's, I thought that I wanted to work with kids. I just didn't
mhm,
think I wanted to be a pediatrician. So because of that, I actually scheduled my pediatric rotation
mhm,
first. And you'll see this when you get to med school, but you can sort of decide in your third year or second year, whenever you
mhm,
start rotations, like sort of what order you want your clerkships to be. And most people put the one that they want to do like
mhm,
fourth or fifth,
mhm,
so that like
mhm,
they've already gotten a lay of the land, they know how to present. So when they get to their sort of core rotation, they're set up. So I scheduled surgery fourth because I was like, I want to be a surgeon. And I
mhm,
scheduled peds first because I
mhm.
was like, I want to be the really nice people when I'm bumbling around,
Yeah,
I was like, I'm not going to be a pediatrician,
yeah,
so let me do it first.
yeah,
And like 2 days into the rotation, they're like, you realize you're going to be a pediatrician. And I
yeah,
was like, guys, no, I'll probably be a surgeon.
yeah,
I loved it. I like
yeah,
absolutely loved the patients. I loved the people. They were
mhm,
people,
mhm,
like nice and
yeah,
kind,
yeah,
and but like so smart.
mhm,
And then when I did my surgery rotation, I loved it as well. I really did. So then I was like, all right, well, I love them both. So let me do ped surgery. So I did several ped surgery, sub-Is and rotations. And I really loved it. However, and this is where like I always kind of I love my job, so I know it worked out for the best. But I went to UVA for med school, and at the time there were only male and only actually now that I come to think of it, like the senior residents and fellows were all men too. And like my mentor at the time sat down with me and he's like, look, if you want to do this, I will write you a glowing recommendation. He's like, but I just need to tell you this. If you like anything else just as much as this, he's like, I recommend you go into that. He's like, because it's going to be really difficult for you to have a family. And honestly, I would never give that advice today because I've seen many pediatric surgeons that have kids, they have a life. So I don't think that was good advice. However, I think it was the right advice for me at the time because it got me to where I am, right? So, and I took it to heart and I was like, honestly, I like pediatrics just as much. I know I don't want to do general pediatrics. So not in my wheelhouse, but I was like, I'll do a subspecialty. And so then I did the NICU sub-I. I loved the neonatal ICU. So like I was like, I'll do pediatrics and do one of the ICU fellowships. So that's, I know, a long-winded answer, but it just, I like to tell this story though, because, you know, my niece, it's funny. I don't know if she's going to watch this, but she wants to be a doctor and she's absolutely sure she wants to be a trauma surgeon. And I tell her, I was like, you know what, if you want to be a trauma surgeon, you can absolutely. But I was like, I want you to keep your eyes open, you know, because I think if you decide early what you want to do, not open to anything else, you could be a specialty that you didn't even know you wanted to do.
And all of my friends have told me as well that you really do not know until you start rotations. Because I have a friend who wanted to be OBGYN, like from the get-go. And then now she's in emergency medicine. So you really never know until you go through the rotations, I believe. And along with the topic of pediatrics, well, what a year it has been for the topic of pediatrics, right? In relation to the whole pandemic. I feel like every time I go through my feed on Instagram and also your post as well, Dr. Patel, it's like, wow, it's really such a divided issue, right? It's such a divided issue that's complicated by so much misinformation and all this fake news and fake information from articles. How does that affect you as a physician in that field, seeing all of these misinformation, especially that you're on social media so well?
Yeah, it's been really hard. Really, really hard. You know, you can probably see, like, I was kind of intermittently educating about COVID for a while up until the past month or so when I really, like, went face first into it. And I did that in the beginning because I was like, you know, when COVID first hit, I did a lot. And then I kind of took a step back. I actually had a baby. And then I was like, all right, I'll do COVID education once in a while, but like it's just I'm living it in the ICU every day. So I wanted to like not make social media stressful. What changed the game for me was an article written, I believe it was in the Washington Post by several really smart doctors, but they were smart adult doctors. And again, I want to emphasize that these are incredibly smart, well-respected doctors. So I'm not knocking on them as physicians, but I disagree with what they wrote. And what they wrote was, we need to send our kids back to school without masks. That article was a turning point for me because it was in the mainstream news. It wasn't on just social media. It was mainstream news. I got so mad. I was screaming with a bunch of my pediatrician friends that are also on social media. And one of them actually, Tina Talib, she's Teen Health Doc. I don't know if you don't follow her. She's great. And she was like, look, you know, yeah, I'm mad too. But at the same time, us pediatricians have to also step up. And that actually really stuck with me. And I was like, you know, I keep getting so pissed off whenever I see hear adult doctors minimizing kids.
Mhm.
But if I'm not actively speaking out myself,
Mm.
then I don't really
Yeah.
deserve I don't have the right to be mad.
Yeah.
So that's why I started to speak up, and now it's like basically all COVID all the time,
Yeah. Yeah.
and particularly with the Delta variant,
Yeah.
it really changed the game. Just to answer your question, it was really honestly painful, physically painful, and obviously
Yeah.
emotional to take care of these kids in the ICU and
Mhm.
go to social media and have everyone say kids don't get COVID. And
Yeah.
like, that was just stupid, right? Of course,
Yeah.
kids get COVID. And
Yeah.
I also always want to impress upon my followers that, like, yes, most kids are not getting super sick, which is so great, right?
Mhm.
Like,
Mhm.
God, that most of them are not
Yeah.
getting sick.
Mhm.
But there are a cohort of them that are. And I just always want people to put themselves in the, don't put yourself in my shoes, put yourself in
Mhm.
the shoes of a parent.
Yeah.
As a kid
Mhm.
that got very sick from COVID, I have sadly seen kids die from COVID, not
Mhm.
even from accessory issues, but from COVID. And kids get tracheostomies from COVID. I have seen
Mhm.
kids in the
Mhm.
ICU for months with COVID. And of course, I've seen
Mhm.
milder cases, that the lucky ones, quote unquote, that just
Yeah.
under the IPAP, but
Yeah. Yeah.
still, I've been taking care of these kids.
Mhm.
And can you imagine if you're a parent seeing the news every day saying that kids are fine, kids can do what
Yeah.
they want, and
Yeah.
your child is in the ICU because of
Yeah.
that rhetoric? And it particularly the rhetoric of, well, only kids with comorbidities,
Yeah.
COVID.
Or autoimmune disease. Yeah.
I'm like, so that means that these kids with comorbidities don't matter then? Like,
Mhm.
just like we're talking about the elderly and the
Yeah. Yeah.
immunocompromised, those
Yeah.
kids are equally as important, if
Mhm.
not more. They have
Yeah.
years and years of life ahead of them.
Yeah.
So that's honestly, I mean, it was very painful, but it actually really helped me to start to be more vocal and
Yeah.
really, yeah, it's time consuming and at times stressful to like
Yeah.
balance this
Yeah.
and my job and obviously my
Yeah.
family.
Yeah.
Thank God my husband is like super supportive, but it was really, really, really freaking hard. But I
Yeah.
I will say it's gotten a lot easier.
Yeah.
I feel like I'm contributing and
Yeah.
saying something. And
Yeah.
if people choose to listen or not, that's their
Yeah.
prerogative. But at least I feel like I'm doing my part and not
Mm.
just getting frustrated.
Yeah. Yeah,
So
I like what you said when you posted that article from Washington Post. Actually, I think your caption was, "Why don't you let the pediatricians talk about the children?"
yeah.
Right, which is so true. Because I first read the article actually from Washington Post, and I was looking at the authors, and I said, "Wait, none of these are pediatricians."
Um,
So what? And that was a big question that was sent in my DMs when I started promoting our live.
yeah.
Is during this year we heard the news of return to in-person education again for kids,
Yeah.
right? Did you feel like it was time for kids to go back to school?
Yes, I do. I absolutely do. So last year, I mean, here's some stats for you. So, first of all, the amount of teen suicide
Mhm.
went up. I mean, there are figures anywhere from 20
Mhm.
to 40%.
Mm.
And that is largely because they were stuck at home,
Mhm.
anxious because of the pandemic,
Mhm.
isolated, and
Mhm.
a lot of people don't have social support. A lot
Mhm.
of people don't have economic support,
Mhm.
nutrition support, right?
Mhm.
Like kids get their food from school.
Yeah.
So,
Yeah.
and what I also want to say is that we're in a really different place in the pandemic now, where in the beginning we had no idea
Mhm.
what mitigation strategies, what
Yeah.
measures would
Yeah.
work. Now
Yeah.
we know. It's not
Yeah.
like we don't know. We
Yeah.
actually know.
Yeah.
So I do think it was time to go back to
Mhm.
school, but it's time to go back to school with the layered protection.
Yeah.
Like,
Yeah.
obviously all staff vaccinated,
Yeah.
all kids masked,
Mhm.
good ventilation, fans on, windows open, HEPA
Mhm.
filters. Like,
Mhm.
with all those measures in place, the risk of getting COVID is enormously
Yeah.
low. I mean,
Yeah.
we see it. I'm not making
Yeah.
it up.
Yeah. Yeah.
Show that, right?
Yeah.
Like, we saw in one article that with good like HEPA filtration
Mhm.
ventilation alone, not
Mhm.
even including masks, it imparted
Mhm.
a 44% risk reduction. You
Mhm.
add universal masking, and that's going to go to the high 90s.
Yeah.
So, we're in a different place, but
Yeah.
it's also very frustrating that we know how to protect the kids, but
Yeah.
obviously a lot of schools. I think that's the
Yeah. Or not. Yeah.
is that kids need to go back to school, but they need
Yeah.
to be able to go back to school safely
Mhm.
with all these measures in place. So, just to circle back to your question, yes, I
Yeah.
firmly, staunchly believe, along
Mhm.
with every pediatrician and the
Yeah.
American Academy of Pediatrics, that our kids need to go back to school.
Yeah.
However, we're telling people they need to go back to school safely.
Safe.
And it's just heartbreaking. I get hundreds of DMs every day from
Yeah.
parents like, my
Yeah.
school isn't, following precautions. What do
Yeah.
I do? And
Yeah.
the situation is so unique.
Yeah.
It's just taking a toll on
Yeah.
everybody.
Yeah. So like you said, with safety measures back in place, and I feel like at the forefront of that is the vaccination of the staff, right?
Yeah.
Especially for grades or vaccination for children are not yet approved. So I was talking to some friends the other night, and I told them that there is real-time hard evidence data we see between like the trend between the effectivity of the vaccines, because the states with the higher vaccination rates have the lowest hospitalization rates.
Absolutely.
But how about for grades and age groups for children where vaccination is not yet disseminated for? How do we combat that issue for?
Yeah. I mean, it's actually not complicated. So, first of all, if everyone around the kids is vaccinated,
Mm-hmm.
the kids are going to have an incredibly low it's
Yeah.
not zero, but they'll have a much lower likelihood of getting COVID. So that's
Mm-hmm.
the first and foremost most effective measure to protect.
Yeah.
And then beyond it, it's the measures I just told you.
Yeah.
If there's good ventilation in the class,
Yeah.
kids are wearing masks.
Yeah.
I have there's that a salon example where the barber had COVID, but
Yeah.
she was wearing a mask and
Yeah.
all of her clients were wearing a mask. Almost nobody or one person, like, there was almost no transmissions. And then there are
Yeah.
examples of salons where they had COVID and weren't wearing masks, and then everyone got
Yeah.
it. The same with schools,
Yeah.
right? So it
Mhm.
all goes back to the layered protection. And if we do that layered protection, the kids will largely be okay.
Yeah.
It's just when we have these breakdowns in certain states where they're not letting schools
Yeah.
protect kids in the ways that they want to, that it gets a little murky. And I always remind parents, yes, masks work best when everybody's wearing a mask,
Mm-hmm.
but kids do get some protection even
Yeah.
if they're the only person wearing the mask. So,
Mm-hmm.
if they wear a normal cloth mask and
Mm-hmm.
no one else is, like a 2-ply, at least ideally 3-ply cloth mask, they're going to have anywhere from like 50 to 70% protection, likely more in the 50% range, because no kid is generally wearing a mask
Right.
perfectly,
Yeah.
but are remarkably good at it. And then if everyone's wearing a mask, and if they
Yeah.
all right, let me go through the mask. So normal cloth, like 50 to 70. If they're wearing a surgical mask, it's a little higher than that. And if
Mm-hmm.
they're wearing one of the
Yeah.
KN95, KNF,
Okay.
KNF,
Yeah.
or
Kind yeah.
they're if they actually wear it
Mm-hmm.
properly, they're
Really.
like 98, 99
Mm-hmm.
protected. So that's actually my general suggestion for parents, that if their kids are in a school where they don't have mask mandates and their kids will actually wear the
Mm-hmm.
K5 or KF94s, I
Mm-hmm.
highly recommend those if they're nervous, because
Yeah.
they're a great alternative. They're much more comfortable, as being a nurse. Like, they're much more comfortable than
Yeah.
normal
Yeah.
N95 wear.
Yeah. I mean, it's just also sad to see like how some states have allowed children to resume in-person classes with no mandates
Oh,
whatsoever, right? And it's
it's
yeah,
insanity. It's
yeah,
and I think it's not only is it insanity, but I think the saddest part about it is that, because there were highly respected physicians,
yeah,
and granted, this was pre-Delta that they were saying this, but even post-Delta, they're still
yeah,
the efficacy of masks.
yeah,
That degrades trust. And they keep saying, and I did a whole post on this recently,
yeah, yeah,
we need to do a study of kids in masks. Well, first of all, we have the data now
yeah,
because
yeah,
schools opened without
yeah,
masks.
yeah,
Unfortunately, we have the data,
yeah,
but
yeah,
they keep saying, well, there's been no randomized controlled trials, so don't know if they're effective. I mean, that's just absolute
yeah,
nonsense. Like,
yeah,
it's physics. We know
yeah, Yeah.
masks work.
Yeah. Yeah.
And kids are wearing them remarkably well. And that is why no pediatrician is saying this, because we see the kids wearing
Yeah.
them. It's the adult doctors that have no like
Mhm.
interaction with these younger kids that think, oh, they can't possibly wear
Yeah.
them. You know
Yeah.
what? They can and they are.
Yeah. And it's very funny too how most of the misinformation about what's going on inside the hospital, inside the ICUs, are made by those who are not even working in those units, right?
Yeah.
So as someone who's working firsthand, face to face in the pediatric ICU, what have you seen either the past few months or the past few weeks with the rise of Delta? Or, and this has been a big question in my DMs when I started promoting our live doc, are children really getting sick critically because of COVID-19 itself?
Yes,
Yeah.
they are. So they are for the most part, and this is the good news. Good news for some, I guess, is that for the most part, the kids that are getting COVID, getting intubated, etc., those are unfortunately largely, minorities who are obese.
Mm-hmm.
Obesity across the board, across
Mm-hmm.
every peds ICU seems to be the number one risk factor. Absolutely, we are seeing kids getting sick with COVID. Now, also have a cohort of previously healthy kids that are getting sick and intubated with COVID. But I will say the caveat, because that started to scare me, obviously, as having a 17-month-old.
Yeah.
I was like,
Yeah.
oh,
Yeah.
like not as by any means
Yeah.
immune, but I was like, she gets it, she'll probably be okay. However, the kids that are previously healthy and ending up intubated with COVID, for the most part, not everyone, but for the
Mm-hmm.
large majority, they have also other viruses along
Right.
with COVID. So
Right.
COVID, RSV,
Mm.
rhino. Pre-COVID, the just
Yeah.
normal
Yeah.
virus or RSV
Yeah.
get a normal
Yeah.
kid. That's not new. So that's kind of the landscape. I will say also our uncontrolled asthmatics being admitted more with COVID. I just want to touch upon the asthma component because it's the
Mm-hmm.
most common question I get. My kid has asthma, are they increased risk? It's really important to know that if you have well controlled asthma as a
Yeah.
kid, you are not at increased
Yeah.
risk of COVID. It's
Yeah.
only the uncontrolled asthmatic. And that's why I tell all my asthma parents, make sure you are actually going and seeing your pulmonologist, your lung doctor. Make sure that, I know everyone's been scared throughout the pandemic.
Yeah.
I actually think those cases are the ones that absolutely to make sure if they need a controller med, they get their controller meds and they're on top of their asthma, because if they are, they'll be okay. And we have had a minority of kids under like 1 year and below that also get sick with COVID. But for the most part, those kids do end up in the ICU, but they end up
Mm-hmm.
on flow. Again,
Mm-hmm.
if they have other viruses along with COVID, in general,
Mm-hmm.
they don't get intubated. And we have, just because you asked, we have absolutely seen an increase in cases. I would say my ICU right now is 10 to 20% COVID, which is a lot. It's a
Wow.
lot. We're basically back to our peak. I guess when was the last peak? In January. So we're kind of back there. And now we're unfortunately also seeing multi-system inflammatory syndrome in kids. And it's happening now because that happens 3 to 6 weeks after an initial infection. So we suddenly are seeing an uptick in MISC too. And what I will say about MISC, that is not attacking kids with comorbidities. It is specifically, we've seen it almost solely in healthy kids who are like 9 and 10 up to
Mm-hmm.
like 16. We're
Mm-hmm.
seeing it in those kids. They're almost all previously healthy, and
Mm-hmm.
those kids get really, really sick. Now,
Mm-hmm.
fortunately, we know exactly how to treat them. It's like we know it, we can smell it the second they step in the door. We have a series of lab tests we do and imaging, and
Mm-hmm.
it's very fortunately for us, it's easy to diagnose and we have good treatments for it. So although they get very, 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 very sick very quickly, they
Mm-hmm.
recover too quite
Mm-hmm.
quickly. But those kids end up, I've had some with breathing tubes. I've had almost all of them get central lines, arterial line, they get all the support. But again, we have not lost one of those in our ICU, but we also have seen so many that we have a really high index of suspicion for them. So we get them treated really early. So that's kind of the link of what we're seeing right now.
How does that affect all of you as, the physician of these children? And I always say that pediatricians, or all those who are working in pediatrics, your patient is not just the kid on the bed, right? It's the parents also.
No, I spend more time with families than I honestly, you end up.
More time. Yeah. How do you juggle that emotionally, I guess? And I feel like it's so heartbreaking to see these children suffer, even prior to the pandemic or even prior to COVID-19, those children who are already in the PICU. As the physician of these children, how do you manage that in your heart and in your mind, seeing these children sick who have this whole life ahead of them and these parents asking you, what's wrong with my child?
I will tell you that that always depends on the case. I mean, every case is heartbreaking, but you learn over time to accept, even though it's sad in the moment, I've learned to get personal satisfaction from giving those kids who don't survive a really honorable and respectful and comfortable death. And that's how I realize that my care for those sort of fun, like really great saves is just as important as ushering and guiding families to either withdraw care drawing, when they end up dying. So that's how I kind of combat the feeling of hopelessness, because it's not hopeless. There always comes a point where there isn't, in some cases, where there's nothing left to do. And that's when, honestly, the real work comes in, when you are with that family and you know that you are with that family during the worst moment of their life. And it's your job to make that worst moment as, I don't know, for lack of a better word, like as good or as memorable in a good way as possible. And we do these really nice things like memory boxes and things like that for parents, where they get to do like fingerprints, hair locks, handprints. I often will do them with the family if they will ask them, do you want me to do it with you? Just if they want that support. So I think participating in that sort of, and I also, something I do sometimes as well, particularly in patients where I've gotten incredibly close with them and the family, is I'll help the nurses when they're cleaning up the child after they died. And I just find, I don't know why, but like it gives me some closure. And I think that's something that I didn't realize I needed even a couple of years ago. Doing that with the nurses and like sort of that ceremony of like washing them and everything also helped me to get closure with those children and say goodbye. I think I didn't realize how important it was for me to say goodbye to the patients. One of my yoga teachers actually told me that. They're like, you need to say goodbye to each of your patients you lose. And I never really thought about that, but I do that. And so those cases I emotionally and mentally can handle. The cases I am able to live my life and be okay, but I do take home are the preventable cases, like the horrific child abuse cases. Like that didn't need to happen. That's another reason why kids need to go back to school. The rate of child abuse has gone so high. Because, and in some ways, I can't even blame the families because they have zero social support, zero economic support. They are at their wits' end. And I mean, not that I would ever condone touching a child, but you can almost see that these families are, that doesn't happen unless something is going on. So those cases are enormously hard, especially because I have to like interact with often the perpetrator. And honestly, now the COVID cases kill me because I see every pediatric COVID case as a preventable illness. I lost a patient. I mean, it took me, I think I'm still recovering from that when I lost a patient just to COVID. Like he didn't have, I mean, he had comorbidities, but he passed away from COVID. And that family in particular was just so sad. Like the whole family had COVID. So I was calling the mom in the ICU. She was in the ICU telling her her son had passed. And the dad was there in the room, but he had COVID and was sick. 5 siblings all had COVID. It was just like, how do you, it was just awful. And they were, of course, were the loveliest family, it's like mother, father, the absolute most amazing family.
Yeah.
So, those cases, that also, honestly, that made me go also headfirst into education. It's
Yeah.
like, to answer your question, how do I deal with those cases that do
Hmm.
me inside, like emotionally, funnel the anger into action. And for me, my action when I get mad about all these cases, I'm like, all right, what am I going to educate today? Or let me do story questions and things like that, just so that I can move that frustration and anger into
Yeah.
something useful.
Yeah.
And my mental health, even though I'm like 10 times busier and sleeping less
Yeah.
because of all the education, I am much happier.
Yeah. Yeah.
So,
What what's your prognosis for all of this as a closing question for this topic of COVID-19 pediatrics? Where do you see this going? I think a common question that everyone is asking, but especially parents in relation to this is, will it ever end?
yes, I think there's a nuanced answer to that.
Mm-hmm.
Will life as it is now change
Mm-hmm.
and go back to some semblance of normal? Yes. Will COVID go away? No, it will not.
Yeah.
This is going to be a disease now, right?
Yeah.
It's going to
Yeah.
be part of our lives
Yeah.
forever. But the difference is that we have a vaccine for it. So
Yeah.
there is an end point. The second my daughter is vaccinated, I will be able to breathe fully, right? Because even if she's around a ton of COVID, even if she gets, and I keep saying COVID, let me be more specific, if she's exposed to the SARS-CoV-2 virus and God forbid she gets COVID, she's vaccinated, she's not going to get
Yeah.
sick. She's probably going to have a common cold. So I think that's what's important to remember. And I think this is a piece that is really missing. And I'm trying to figure out I feel like I keep trying to explain it, and I know other doctors are too. But obviously, it's not getting to everybody that if you are vaccinated and then get COVID and have just a common cold symptom, that is a success, right? The whole point is you got it and your body fought it off and you didn't end up in the hospital or dead.
Mm-hmm.
So, again,
Mm-hmm.
if everyone who is eligible to get vaccinated gets vaccinated, and if people opt not to at that point, that's their decision, right? But like, if everyone who's eligible and is offered the vaccine has had the opportunity to take it, I
Mm-hmm.
think at that point our world, or at least our country, can go back to some semblance of normalcy. I mean, kids, though, I do believe in vaccine mandates for kids, but that's been around for decades, right?
Yeah.
Bunch of vaccines, so that's not new. But as long as we get all of our kids vaccinated and all the adults that want to get
Yeah.
vaccinated, I do see a way out. But I will tell you this, I don't see a way out until we get the whole world vaccinated, which
Yeah.
is why, to be honest with you, I'm actually staunchly against this booster I'm not against the booster campaign for immunocompromised
Yeah. Yeah.
and elderly who have
Mm-hmm.
immunity. I am absolutely against it for like the rest of the
Yeah.
country, because if we don't get the rest of the world
Yeah.
back,
Send it over to the rest of the world, right?
it will not end. Then this
Yeah.
will, right? Because
Yeah.
there will be a variant, and there already is a variant, right? The mutant variant that
Mm-hmm.
is going to outsmart our vaccination.
Yeah.
So,
Yeah.
do I think that there's an end to this? Yes. When
Yeah.
that end is going to happen is going to depend on when, rich countries like ours,
Yeah.
and they keep saying they're going to do it, but then they send it when it's about to expire, and that's
Yeah. Yeah.
right.
Yeah.
So when our country actually makes a concerted effort, and Biden did say he was going to get the world vaccinated, then that's going to be the end point. But to say
Yeah.
that we're not going to say goodbye to COVID, though, and I think it's important for people to know that, and it's
Yeah.
why you need to get vaccinated,
Yeah.
right?
I agree. We've talked a lot of about a lot of heavy topics today and so many interesting topics and topics that people want to hear. Through all of this, seeing agony in children and the family. And I know you talked about yoga as your means of decompression. How is the life outside of work? How do you decompress from work? Like after such a heavy shift, how do you decompress once you get home?
Well, I basically have a routine. I like run home as fast as I can, spend time with my daughter. And I mean, I spend every second, I don't even think about work while I'm with her. I really
Hmm.
put it to the, well, first I shower
Yeah.
and then I spend time with my daughter and husband. We always eat dinner together.
Mhm.
And I generally work out in the morning. So working out regularly incredible, like, is like either the Peloton, yoga. I run with my daughter and with a running stroller. So running, spending time, or any exercise, spending time with my daughter and my family. And then my husband and I are purveyors of trash. So we love The Bachelor. We love a Real Housewives of Beverly Hills. You know what? Watch some dumb TV.
I love it.
And I own it and I am fine with it because you know what? I go through so much at work, but I think it's important to just like
The amount of doctors who watch The Bachelor really amazes me. It is so funny to me. It's like all white collar work, and then you watch this.
I don't know how. And honestly, like I watch it and think like or anything. I'm just like it's like watching a train wreck. You just can't stop watching.
Yeah,
Um,
I
yeah.
love.
Also,
I love
one other thing I do is I really love healthy baking. Like that's like kind of a side passion of mine. So you can see some back there. That's
yeah,
like 1% of the number of plants I have in my house. So healthy baking, like really easy healthy baking and plants are also like passions of mine. And that's one thing I will say that gets me through every hard day is remembering I used to just be a doctor, just
hmm
be a doctor.
hmm hmm
But I really realized that I actually am so much of a better doctor. I am
yeah,
a more productive researcher. I am just more productive in life when I actually devote time to my home life and my home passion.
yeah,
And that's what has sustained me. Yeah, that's what sustains me. And that what sustains me. I mean, I had honestly the hardest week of my entire career a couple weeks ago
yeah.
without a doubt. And yeah, that's what I did. I just made sure I spent time with my husband and my kid, and I took help from my parents. My parents are local, so I am much better at accepting help as well
Yeah,
because I know I can't do all these things if I don't have help. And that has all really helped me to get through this.
yeah, yeah. And that's such an amazing message of how much self-care is so vital, right? Especially for such a stressful job in healthcare,
Yeah.
right? And I know you're super busy, and you graced me with your time and
Oh,
presence
I
today.
appreciate you talk. I mean, this was so fun, and I'm so sorry for
No,
the.
it's okay, dog. It's okay. I literally was just like my eyes flashed before me, and I was like, did I did I wake up a day late? I was like, is it
Typical in
is this?
a way. And, like some of my friends are like, "How are you a doctor?
No, I love it. I love it.
How are you
Well,
like working and like doing all this research when you are like a bobblehead half the time?" But
no,
part of
it happens. It's the best. But Dr. Patel, thank you so much for being with me today. I had so much fun
it
and
too.
I learned a lot.
Thank you for doing this. This is really wonderful, and I cannot wait until you're here. And as I told you already, you let me know if you need anything. I mean,
Yeah.
I really do. You're gonna be great. You're gonna be amazing. Honestly, nurses make the best doctors. So,
Thank you so much, Dr. Patel. I hope you have a great day.
too.
And
All right.
say
Bye.
bye. Thank you.